Hello and welcome to the Mental Health Awareness video series. My name is Dr. Lynette Hillsberg and I am a counsellor. The subject of mental health is rarely discussed. Knowing what can control or change our mental health is important. We need to understand why we feel different and how the choices in our lives can affect our overall mental state. These videos are aimed to help open the conversation to bring awareness of this sensitive topic and encourage people to reach out for support if needed. The information will benefit the deaf, hard of hearing, vision impaired and hearing communities because the information is given in sign, voice and closed captions. As Auslan is my second language and out of respect to the community, I feel it's important that I have a deaf person sign on my behalf while I do voiceover. I would like to introduce James as the interviewer and Trisha as my deaf person who have agreed to help me raise awareness around this sensitive topic. I'd also like to acknowledge the traditional custodians of this land and pay our respects to the elders past, present and future, for they hold the memories, traditions, culture and hopes of Aboriginal Australia.
Hello and welcome. Today we are chatting about quite a difficult subject, which is suicide. Specifically people who try to harm themselves. With me today, I have Dr. Lynette Hillsberg, who will discuss what it means when someone talks about or wants to take their own life. Welcome, Lynette, and thanks for chatting.
Thanks, James. It's a pleasure to be here.
Suicide. It's not a very nice topic to discuss. People normally don't talk about this.
Yeah, right. The topic of suicide is normally never talked about in either the deaf, blind or hearing community, as it's a really sensitive topic. It's because it's regarded as being a shameful act, but some people do suicide, and as we as a community need to have awareness of this and why it happens, and sometimes when we least expect it.
So, what is the definition of this? Because people refer to it as an accident or taking one's life.
Well, technically suicide is the voluntary act of killing oneself. It's hanging, it's slicing wrists, taking poison or things like that. It's also called suicide completion or successful suicide.
That's very clinical.
Yeah, it's the official medical diagnosis used when someone does this.
So, what makes people do this?
Well, there can be multiple reasons. They may have complex underlying mental health illness or issues including severe stress with pressure that they just can't deal with. Be in a situation where they feel that there's no other way to deal with their life because of a social or family reason, or sometimes it's an accident where the person may self-harm or take drugs and not realise that they're going to die.
Can you give an example of this?
Well, one example can affect young people when dealing with social media. There might be threats and the person isn't able to tell the family, or they're too frightened. They feel they'll be hurt, and emotionally this makes them feel that no one likes or loves them. And with the stress of this, they feel it will be better for everyone that they just go away. Plus, the bullies are telling them to go and kill themselves and send them hateful messages. Or a person may be in debt, maybe from gambling and has lost everything that's important in their life, and they just can't face their problems or responsibilities. Another example may be the person takes drugs and that makes their thought patterns change. In their mind, it's another state and they believe that they're invincible, and they're taking risks like jumping off a balcony or running into traffic.
So, why does this happen to one person and not another?
Overall, it depends on how resilient the person is in dealing with their problems. Everyone's different. For that person, suicide is usually seen a way of dealing with a problem or crisis, which is in causing the intense pain and suffering.
So, when people do this, are they violent?
No, the discussion of suicide in the press and on TV contributes to this stigma and can manipulate you into thinking that they're violent.
What about those people who try to suicide and fail?
Yeah, this is called para-suicide, and that's voluntary failed attempt to kill yourself. It's frequently called attempted suicide, and this varies by intent. For example, some people truly wish to die, but others simply wish to feel nothing or be out of pain for a while. Some attempt suicide because they want to send a message to others about their emotional state.
I've also heard the term suicidal ideation. What does that mean?
This is where the person is thinking about and planning their own death. It includes also excessive and unnecessary worry about losing a significant loved one.
Why is there so much stigma around this topic?
Unfortunately, mental illness has stigma. Speaking about or attempting suicide makes mental illness obvious to others. This is especially true if the person who attempted suicides needs medical help or psychiatric hospitalisation, because now it's visible the person has attempted suicide and it discredits the person.
What about people who are feeling hopeless due to situations they can't change, or it's been forced onto them like a pandemic situation? Does this affect the person's mood so much that they want to die?
Suicidal behaviours are a direct consequence of certain mood disorders. For example, recurrent major depressive disorder. Feeling hopeless does not normally lead to suicidal thoughts, as mentioned before. It depends on the person's resilience to the situation and how they cope with life in general. The risk of harm to yourself or others is increased because of the condition that you're in, because of your intoxication.
What do you mean by this?
Well, suicide is highly preventable. People commit suicide because other people don't recognise the signs. Sometimes the mood disorders are not treated, or people with suicidal thoughts fear the social stigma of discussing their problems.
What are some of the behaviours that may indicate the person's intent to suicide?
When a person has the intent to suicide, they may act in a certain way so they won't be discovered. And this may be that they have previously attempted suicide and not told anyone. They plan it so they're isolated and won't be disturbed or discovered. They made preparations like leaving a suicide note, giving away their things, or making funeral plans. They have excessive thoughts or detailed plans about the act, and have told people of their intentions.
So, how can we help someone who might be at risk?
If a person is mentally unwell, has set a plan in place, has attempted suicide before, or even talks about dying, then discussing suicide with them may help them open up and talk about whatever the problem is.
I'd be afraid to talk about this because if I talk about it, what happens if the person actually does commit suicide?
Yeah, you're perfectly right, and that's normal to think that. People don't like to talk about this topic, but to assist someone you feel may be at risk, you may need to determine their intent, and you can help them by asking some questions. Normally, when a person goes to the doctor and says that they're feeling down, a risk screen is done to determine if the person is thinking about killing themselves.
Okay, so what are these questions and is it okay to ask them because I'm not a doctor?
Yeah, it's okay to ask them because if the person talks about their thoughts, it then brings this into the open and it may help them realise their intentions, and at the same time they'll see that you are worried, care about them because you are talking to them about their problems.
Okay, so what are some of the questions?
Well, some of the questions you could ask could be, have you thinking about hurting or killing yourself? How seriously do you want to die? Have you attempted suicide before? Is there anything in your life that might keep you from killing yourself?
Right, so then what's next?
Well, the next thing is to find out how serious the thoughts are. You can then ask, how often do you have these thoughts? How long do they last? How much do the thoughts upset you? Can you dismiss them or do they return? Are they increasing in intensity and in frequency?
Right, so I find out about their thoughts and how serious they are, then what do I do?
Well, the next thing is to find out if they're planning to go ahead with this. So you can ask, have you made any plans to kill yourself? And if so, what are they? Do you have any access to any of these materials like ropes or guns, knives or pills? And how likely is it that you would actually do this? And what have you done to put your plan into action? And what is it that will stop you from killing yourself?
Wow, that's a lot of questions. But what happens if you find out if they've already hurt themselves?
Well, if the person tells you they've hurt themselves, please consider medical treatment. If it's urgent or life-threatening, then please call an ambulance, particularly if the person is uncooperative or potentially harmful or dangerous situation.
Okay, so finding out if the person is going to suicide is one thing. You've asked all the questions. What do we do with the information and how do we stop them from going ahead with it?
Well, to do this means talking to them about their answers and trying to find a solution for their problem. Try to understand what's happening for them. As well as being non-judgmental, you can then work with the person to create a safety plan. That is, things that they can do to make themselves feel safe, like talk about reasons to live. Things like family, friends or animals that love them. Make the environment around them safe. For example, give their medications to another person, removing all sharp objects. Have them talk to family and friends when they do feel suicidal. And identify things to do to distract their thoughts, like maybe going outside for a walk. Paint or create art or write or journal their feelings. Practice grateful mindfulness, connect with people and places, and maybe use online therapies if they can't get out, attend weekly therapy sessions, that sort of thing.
That's great help knowing these steps. But what happens to the family if the person has died?
Suicide has a devastating effect on everyone it touches, especially family and close friends. Long-term suffering can be caused by the sudden shock of finding out the unanswered why and potentially the discovery of the body. For each suicide, it can leave at least 6 survivors. Suicide grief is different to those loved ones whose death was not self-inflicted. The social processes affecting the survivors, the unique grieving process, and the effect on them is they have more stigma, shame, and rejection than any other families. Coping abilities are different for each person, and recovery from a loved one's suicide is ongoing. Survivors who are emotionally healthy before the suicide act usually have social supports and are able to manage psychological trauma better. So if someone you know has experienced this, please have some compassion and understanding when speaking with them.
If I wanted more help on this topic, where do I go?
You can call Lifeline, Beyond Blue, Mental Health Helpline, Reach Out Australia. There's also a suicide callback service, or see your GP and link it to counselling services under Medicare. There's also suicide first aid training available that you can do.
Well, thank you for that information. It's been very helpful, and it's been lovely to chat with you.
Thank you, James. You're most welcome, and lovely to chat with you as well.